The most dangerous pill in your home may not be locked inside a prescription bottle. It may be sitting beside your bed, in your bathroom cabinet, or tucked inside a cold medicine box you have used for years without concern. After age 60, 5 common types of pills can place extra pressure on the heart and blood vessels, sometimes without causing an obvious warning until the danger becomes serious. This does not mean every person taking these medicines will have a heart attack or stroke. It also does not mean you should suddenly stop a prescription. But it does mean that a pill that seemed harmless at 45 may affect your body very differently at 65, 75, or 85. As we age, arteries often become less flexible. The kidneys may clear medicines more slowly. Blood pressure can rise more easily, and combinations of prescriptions, pain relievers, cold remedies, and supplements may create risks that no single bottle reveals. The 5 categories we will examine include certain pain relievers, oral decongestants, some forms of hormone therapy, antipsychotic medications used in older adults with dementia-related conditions, and stimulant-type weight loss pills. Some can narrow blood vessels. Others may raise blood pressure, increase fluid retention, disturb heart rhythm, or raise the chance of a clot in people who are already vulnerable. The warning signs may be subtle at first. New ankle swelling, unusual shortness of breath, a pounding heartbeat, dizziness, chest pressure, or a sudden rise in blood pressure. But symptoms such as facial drooping, weakness on one side, slurred speech, severe chest pain, or sudden confusion require emergency help immediately. The purpose of this investigation is not to frighten you. It is to give you the information needed to ask better questions. Never stop a prescribed medicine on your own. Instead, bring every prescription, over-the-counter pill, vitamin, and supplement to your doctor or pharmacist. One careful medication review could uncover a hidden interaction, a dose that needs adjustment, or a safer option that protects your heart, your brain, and your independence. To understand why a familiar pill may become more dangerous after 60, imagine the cardiovascular system as a network of flexible garden hoses. When you were younger, those hoses could expand easily whenever the heart pushed out more blood. But with age, the walls of the arteries often become thicker and stiffer. They may not open as quickly when the body needs additional blood and oxygen. This means that even a modest increase in blood pressure can place greater strain on the heart, brain, and kidneys. The heart is also adapting. It may still pump strongly, but it often has to work against more resistance. When a medicine causes blood vessels to narrow, the heart must push harder to move blood through them. That extra workload may be manageable for a healthy younger person, yet far more significant for someone with coronary artery disease, high blood pressure, an irregular heartbeat, or a history of heart failure. Now consider the kidneys, 2 organs that quietly influence nearly every medication you take. The kidneys filter the blood, regulate fluid and sodium, and help remove many drugs from the body. Kidney function can decline gradually, with age, sometimes without obvious symptoms. A dose that once left the body quickly may remain in circulation longer, if another dose is taken before the first has been fully cleared. The medication's effects may become stronger than expected. This is one reason older adults may experience side effects, even when they follow the instructions printed on the label. The dose may be considered standard, but the body processing that dose is no longer the same. Dehydration, kidney disease, diabetes, vomiting, diarrhea, or the use of certain blood pressure medicines can make this problem more serious. Fluid balance is another critical piece of the puzzle. Certain medications encourage the body to retain sodium and water. You may notice tighter shoes, swelling around the ankles, a sudden increase on the bathroom scale, or difficulty breathing when lying flat. That retained fluid increases the volume of blood the heart must move. For a person with weakened heart function, this additional burden may contribute to worsening shortness of breath or heart failure. Blood pressure can also rise silently. Many people expect dangerously high blood pressure to cause a headache, dizziness, or a pounding sensation. Often it causes no clear symptoms at all. A person can feel normal, while pressure inside the arteries is placing stress on delicate blood vessels in the brain. This is why a medication-related increase may go unnoticed unless blood pressure is checked. The lining of the blood vessels matters as well. Healthy vessels produce signals that help them relax and maintain steady blood flow. Some medicines interfere with these protective processes. Others may alter the balance between bleeding and clotting. When blood vessels are already narrowed by plaque, even a small change in circulation can become important. A clot that blocks blood flow to the heart may cause a heart attack. A blockage or rupture affecting the brain may cause a stroke. Then there is polypharmacy, the medical term for taking multiple medications. It is common after 60 because one person may need treatment for arthritis, blood pressure, cholesterol, diabetes, sleep problems, allergies, or depression. Each medicine may have a valid purpose. The danger appears when separate products produce similar effects or interact in ways that are easy to miss. For example, a prescription may already affect blood pressure or kidney function. An over-the-counter pain reliever may add fluid retention. A cold pill may further narrow blood vessels. A supplement may change how another drug is absorbed or broken down. None of these products knows what else is inside your body. Brand names can make the confusion worse. Two boxes may look completely different while containing the same active ingredient. A nighttime cold formula may include a pain reliever that the person has already taken separately. Someone may accidentally double a dose without realizing it. This does not mean aging makes medication unsafe. It means medication must become more personalized. The right question is no longer simply, is this pill available without a prescription? The better question is this pill appropriate for my heart, my kidneys, my blood pressure, and every other medicine I take? That single change in thinking can prevent a routine choice from becoming a hidden cardiovascular threat. The first group deserves special attention because millions of older Americans use it for arthritis, back pain, headaches, and sore joints. These are non-aspirin, non-steroidal anti-inflammatory drugs often called NSAIDs. Common examples include ibuprofen, naproxen, diclofenac, and celecoxib. These medicines reduce pain and inflammation, and they can be useful when chosen carefully. But they may also raise blood pressure, encourage sodium and fluid retention, affect kidney function, and increase the risk of serious cardiovascular events. The risk is not identical for every drug or every person. It generally becomes more concerning with higher doses, longer use, existing heart disease, or several cardiovascular risk factors. The most common mistake is assuming that a medicine sold without a prescription must be safe for daily use. Someone may take ibuprofen every morning for knee pain, then add a nighttime cold product containing another pain reliever. Another person may continue naproxen for months without telling the doctor who manages their blood pressure. The safest approach is to use the lowest effective dose for the shortest appropriate time, under professional guidance when use becomes frequent. The second category is the oral decongestant found in many cold flus and sinus products. Pseudoephedrine works by narrowing swollen blood vessels inside the nasal passages. That can make breathing easier, but the effect is not always limited to the nose. It may also increase heart rate or blood pressure. This matters especially for people with uncontrolled hypertension, coronary artery disease, rhythm problems, or a previous stroke. Read the active ingredients, not only the brand name. Products labeled for sinus pressure, congestion, daytime relief, or severe cold symptoms may contain a decongestant. A pharmacist can help identify a product that is more appropriate for your medical history. The third category is oral menopausal hormone therapy. This subject requires balance because hormone treatment can provide meaningful relief from hot flashes and other menopausal symptoms. It should not be described as automatically dangerous, and women should never discontinue it because of a frightening headline. Cardiovascular effects can differ according to age time, since menopause dose formulation, route of administration, and personal risk factors. Starting treatment near the menopausal transition is not the same situation as beginning oral therapy many years later. A woman over 60 who has a history of blood clot, stroke, heart disease, smoking, migraines, or poorly controlled blood pressure needs an individualized discussion with her clinician. The correct question is not whether all hormone therapy is good or bad. It is whether a specific treatment remains appropriate for one specific woman. The fourth category involves antipsychotic medications in older adults with dementia-related psychosis. These drugs may sometimes be considered when severe agitation, hallucinations, aggression, or psychotic symptoms create significant danger or distress. However, many antipsychotic labels carry serious warnings about increased mortality in elderly patients with dementia-related psychosis. Certain labels also describe cerebrovascular reactions, including stroke. That does not mean families should remove the medication suddenly. Abrupt changes can worsen behavior or create other complications. Instead, caregivers should ask why the drug was started, what symptom it is treating, whether non-drug causes of agitation were investigated, and when the prescription will be reviewed. Pain, infection, constipation, dehydration, medication, interactions, poor sleep, or an unfamiliar environment can sometimes worsen behavior in a person with dementia. The fifth group is stimulant-type weight loss medication, including products containing phentermine. These medicines can reduce appetite, but stimulant effects may increase heart rate, produce palpitations, or place additional stress on the cardiovascular system. Some products are not appropriate for people with certain forms of heart disease, uncontrolled high blood pressure, or recent unstable cardiovascular conditions. This category should not be confused with every modern obesity treatment. Weight management medicines work in different ways and have different cardiovascular profiles. The warning applies specifically to medications with stimulant-like effects, not to all prescription weight loss therapies. Across all 5 categories, the greatest danger may be invisibility. One doctor prescribes a medication, another treats a different condition, and the patient adds several products from the pharmacy shelf. No one sees the complete picture. That is why every pill matters, including the ones taken only occasionally. Write down the exact name, dose, and frequency of each product. Better still, place every bottle in one bag and bring it to a pharmacist or medical appointment. The goal is not to remove every medication. The goal is to make certain that every medication still has a clear purpose and that its benefits continue to outweigh its risks. The body often whispers before it sounds an alarm. After starting a new medicine or increasing a dose, the first warning may seem too ordinary to mention. Your shoes feel tighter. You become winded while walking to the mailbox. Your heartbeat feels faster at bedtime. You feel unusually tired, lightheaded, or unsteady. These symptoms do not automatically mean a heart attack or stroke is beginning, but they deserve attention, especially when they appear soon after a medication change. Begin with swelling around the ankles, feet, or lower legs. Certain medicines can cause the body to retain sodium and water. Press a finger gently against the swollen area. If an indentation remains, fluid may be collecting in the tissues. A rapid increase in body weight can provide another clue. Gaining several pounds over a few days is not the same as gradual weight gain over several months. When swelling appears with shortness of breath, difficulty lying flat, or waking at night gasping for air, contact a medical professional promptly. Blood pressure changes may be even harder to recognize because high blood pressure frequently causes no obvious symptoms. This is why home monitoring can be valuable after beginning a medicine known to affect circulation. Sit quietly before taking a reading. Keep your feet flat on the floor. Support your arm and record the result. One unusual number does not tell the entire story. Repeated readings that are much higher than your normal range should be reported to your clinician. Palpitations are another signal. They may feel like fluttering, pounding, racing, or skipped beats. Anxiety, caffeine, dehydration, fever, and many medical conditions can cause similar sensations. But if palpitations begin after taking a decongestant or stimulant-type pill, do not simply assume they are harmless. Seek urgent help when a racing or irregular heartbeat occurs with chest discomfort, fainting, severe weakness, or trouble breathing. Heart attack symptoms are not always dramatic. Many people expect crushing pain followed by immediate collapse. In reality, discomfort may begin gradually. It can feel like pressure, squeezing, fullness, burning, or heaviness in the center of the chest. Pain or discomfort may spread to one or both arms, the shoulders, back, neck, jaw, or stomach. Shortness of breath can occur with or without chest pain. Women and older adults may also experience nausea, cold sweating, unusual exhaustion, weakness, or a feeling that something is deeply wrong. Never dismiss new symptoms as indigestion simply because they are not severe. Call 911 when heart attack symptoms are suspected. Do not drive yourself to the hospital, and do not spend valuable time searching online for reassurance. Stroke warnings demand the same urgency. Remember that stroke symptoms usually appear suddenly. One side of the face may droop. One arm may become weak or numb. Speech may sound slurred, confused, or difficult to understand. Other signs include sudden vision trouble, severe dizziness, loss of balance, difficulty walking, or an intense headache with no known cause. Ask the person to smile, raise both arms, and repeat a simple sentence. If the smile is uneven, one arm drifts downward, or the words sound abnormal, call 911 immediately. Note the exact time the symptoms began, or the last time the person was known to be normal. Treatment options can depend on timing. Even if the symptoms disappear, after a few minutes, emergency evaluation is still necessary because a temporary episode may be a warning of a larger stroke. Several common mistakes make medication-related danger more likely. The first is treating an over-the-counter label as permission for unlimited use. The second is taking more than one product with the same active ingredient. Cold, flu, sleep, headache, and arthritis products can overlap even when their brand names look unrelated. Another mistake is borrowing someone else's prescription or restarting an old medication without checking whether it still fits your health condition. Kidney function, blood pressure, and other prescriptions may have changed since that bottle was filled. Cutting, crushing, or doubling tablets without professional advice can also alter how a drug is released or absorbed. Do not forget supplements. Natural does not always mean inactive. Herbal products and concentrated extracts can affect blood pressure, heart rhythm, bleeding, or the way prescription drugs are processed. Your doctor and pharmacist need the complete list, including products used only occasionally. The safest response to a mild warning is not panic, and it is not silence. Record what happened when it began, which medicine you took, and any blood pressure or pulse readings. Contact your clinician or pharmacist for guidance. For chest pressure, severe breathing difficulty, fainting, facial, drooping, one-sided weakness, or abnormal speech, skip the notebook and call 911. Recognizing the difference between a manageable side effect and a medical emergency may protect both your life and your independence. Protecting your heart does not mean accepting constant pain, unbearable congestion, untreated menopausal symptoms, severe behavioral distress, or a lifelong struggle with weight. It means replacing guesswork with a safer plan. The goal is not to prove that medication is bad. The goal is to use the right treatment at the right dose, for the right reason, for the right amount of time. Begin with joint and muscle pain, when aching knees or a painful back interfere with sleep and movement. Reaching for an anti-inflammatory pill can feel like the only practical choice. But before using an NSAID, repeatedly ask your doctor, what is actually causing the pain? Osteoarthritis, nerve pain, muscle weakness, gout injury, and inflammatory disease may feel similar, yet they do not always respond to the same treatment. A physical therapist can identify weak muscles, poor balance, or movement patterns that place extra pressure on a painful joint. Gentle strengthening may help the muscles absorb more of the load that would otherwise fall on the knee, hip, or lower back. Walking, water exercise, stationary cycling, and carefully selected range of motion exercises can improve function without requiring intense workouts. Start below your maximum ability. 5 comfortable minutes performed consistently may be safer and more useful than one exhausting session that leaves you unable to move the next day. Mild stiffness when beginning activity can be normal, but sharp pain, chest discomfort, severe breathlessness, or new dizziness is a reason to stop and seek guidance. Heat may relax stiff muscles and joints, while a cold pack may reduce swelling after activity. Protect the skin with a cloth barrier and avoid extreme temperatures, especially if diabetes or nerve damage has reduced sensation. Braces, supportive shoes, a cane fitted to the correct height, and changes to the home environment may also reduce pain by improving stability. Ask whether a topical treatment is appropriate. A medicine applied to a limited painful area may sometimes produce less whole-body exposure than an oral pill, although it can still have side effects and interactions. Acetaminophen may be considered in some situations, but it is not automatically safe for everyone. Excessive amounts can damage the liver, and combination cold or sleep products may already contain it. Always calculate the total amount from every product you use. For nasal congestion, the first question should be why the nose is blocked. Of viral cold allergies, dry air, sinus inflammation, and certain medications require different approaches. Saline spray, appropriate hydration, a humidifier that is cleaned regularly, and sleeping with the head slightly elevated may provide relief without the stimulant effects of an oral decongestant. Do not inhale very hot steam from boiling water. Burns can happen quickly, particularly when balance or vision is impaired. If allergies are the cause, ask a clinician or pharmacist whether a non-decongestant treatment is suitable. Nasal sprays also differ. Some are intended for allergy control, while others can cause worsening rebound congestion when used too long. The label and recommended duration matter. Women using menopausal hormone therapy deserve an individualized review, not a sudden withdrawal driven by fear. Ask whether the current dose is still necessary, whether the route of administration matters, and how personal factors such as age, blood pressure, migraines, smoking history, blood clot history, and previous cardiovascular disease affect the decision. Symptoms, bone health, sleep, and quality of life should be included in that conversation. When antipsychotic medication is being used for dementia-related behavior, supportive care can sometimes reduce the triggers that intensify distress. Check for pain, constipation, hunger, infection, dehydration, poor hearing, sleep disruption, loneliness, or an overwhelming environment. A calm routine, familiar caregivers, adequate lighting, reduced noise, and simple communication may help. These measures do not replace necessary treatment, but they can provide information about whether an unmet need is driving the behavior. Weight management should also focus on health rather than rapid loss. A small, sustainable reduction in weight may ease pressure on the joints and improve blood pressure or blood sugar in some people. Build meals around vegetables, fruit, beans, whole grains, appropriate protein, and foods that are minimally processed. Reduce excessive sodium sugary drinks and portions that have grown larger over time. Avoid products promising dramatic results without effort. A supplement labeled natural may still contain stimulant compounds, interact with prescriptions, or affect heart rate and blood pressure. Discuss any weight loss pill with a licensed clinician who knows your full cardiovascular history. Most importantly, do not replace prescribed treatment with an internet remedy. Bring possible alternatives to your physician or pharmacist and ask what fits your body. Safer care is rarely one miracle pill. It is a thoughtful combination of movement, nutrition, symptom tracking, professional review, and medication used only when its expected benefit justifies its risk. One of the most protective medical appointments you can have after 60 may not involve a new test, a new diagnosis, or a new prescription. It may simply involve placing every medicine you use on a table and asking one powerful question: do I still need all of these in these exact doses at this stage of my life? This process is sometimes called a brown bag medication review because patients traditionally carried every bottle to the appointment in a paper bag. Bring prescriptions, pain relievers, cold medicines, sleep aids, vitamins, herbal products, creams, eye drops, inhalers, and anything taken only occasionally. Do not rely on memory. A complete collection often reveals duplicate ingredients, expired products, confusing directions, or combinations that were never intended to be used together. For each medicine, ask what condition it treats and what benefit you should reasonably expect. Some drugs prevent serious events even when you cannot feel them working. Blood pressure medicine, cholesterol treatment, and anticoagulants may be protecting you silently. Never assume that a medicine is unnecessary simply because you feel well. Feeling well may be evidence that the treatment is doing its job. Next, ask whether the current dose still fits your age, kidney function, liver function, weight, blood pressure, and other medical conditions. A prescription that was appropriate 10 years ago may need reevaluation today. That does not mean the original decision was wrong. Your body health risks and treatment options may have changed. Duration matters too. Ask whether the medicine was intended for a few days, several weeks, or long-term use. Over-the-counter pain relievers and decongestants are especially easy to continue without review because no one automatically schedules a follow-up. Record how many days you actually use them. Occasionally can quietly become every morning and every night. Tell your clinician exactly how you take each product, not only how the label says you should take it. Mention skip, doses, double doses, tablets that are difficult to swallow, and medicines you avoid because of cost or side effects. Honest information allows safer decisions. Hiding a problem may lead the doctor to increase a dose that you were never taking consistently. Ask whether any medicine could be raising your blood pressure, worsening swelling, affecting kidney function, increasing falls, or interacting with another treatment. A pharmacist is especially valuable for identifying repeated ingredients across different brand names. Using one pharmacy when practical may make it easier to screen new prescriptions against the medicines already in your record, although you should still maintain your own updated list. Home blood pressure readings can add useful evidence. Measure at similar times, sit quietly beforehand, and write down the numbers along with your pulse and any symptoms. Also record when you took a pain reliever, cold pill hormone medicine, antipsychotic or stimulant-type product. A pattern may become visible that would be missed during a brief office visit. Do not become discouraged if a clinician does not immediately remove a medicine you are worried about. Medical decisions require balancing risk against benefit. An antipsychotic, for example, may carry serious risks but may have been prescribed because dangerous behavior threatened the patient or caregiver. Hormone therapy may provide substantial symptom relief for a carefully selected woman. The safest choice is individual, not universal. Healthy skepticism means asking for the reason, evidence, alternatives, monitoring plan, and review date. It does not mean believing every online claim or rejecting conventional care. Videos, articles, and testimonials cannot see your medical history, laboratory results, heart rhythm, kidney function, or complete medication list. Be equally cautious with products advertised as natural replacements. Supplements are not automatically safer than prescription medicines. Some can affect heart rate, blood pressure, bleeding, or drug metabolism. Tell your healthcare team about every powder tea, gummy capsule, and concentrated extract you use. Before leaving the appointment, confirm which medicines should continue, which may change, and which should never be stopped suddenly. Request written instructions in large, readable print. Update your medication list immediately and give a copy to a trusted family member or caregiver. Keep another copy available for emergencies. The goal is not to take the fewest medicines possible. The goal is to take only medicines with a clear purpose at an appropriate dose, with risks that are understood and monitored. A careful review can transform a crowded medicine cabinet from a source of uncertainty into a coordinated plan that protects your heart, your brain, and your future. Growing older does not mean surrendering control of your health. It means becoming more informed, more observant, and more willing to ask questions. The 5 medication groups we examined are not automatic enemies. For many people, they provide real relief. The danger begins when they are used without a review. Your strongest protection may be a simple conversation. Place every prescription, over-the-counter product, vitamin, and supplement in one bag. Bring it to a doctor or pharmacist. Ask what each medicine does, whether the dose still fits your body, and whether another product is quietly creating the same effect inside you. Never stop a prescribed medicine suddenly, unless your healthcare professional tells you how to do it safely. Some drugs require gradual changes, and some are preventing problems you cannot feel. The goal is not fewer pills at any cost. The goal is the safest possible treatment for your individual needs. Pay attention when your body changes after a new medication or dose. New swelling, unusual breathlessness repeated. Blood pressure increases. Dizziness or a racing heart should be discussed promptly. Write down what happened and when. A clear record can help your medical team recognize a pattern before it becomes an emergency. But when chest pressure, severe shortness of breath, facial drooping, one-sided weakness, or abnormal speech appears, do not wait for an appointment. Call 911 immediately. Emergency teams can begin care on the way to the hospital, and faster treatment may protect heart muscle, brain function, movement, speech independence itself. Knowledge should never leave you frightened. It should leave you prepared. Every careful question, blood pressure check, medication review, balanced meal, and safe walk is a vote for your future. Small decisions repeated consistently can protect the freedom to live at home. Move confidently, think clearly, and remain connected to family. Share this message with someone who takes pain, cold, hormone, behavioral, or weight loss medication. It may encourage a conversation that has been delayed for years. Subscribe to Seniors Hub 65 for compassionate guidance that respects your experience. Your age is not your weakness. With informed care, it can become your